In this actual clinical example, we'll look at a lower first molar. Good access is a must. As in this example, you should be able to clearly see all the orifice openings. Lubrication and irrigation is strongly recommended. Here, ProLube is being placed in the canal spaces. In this clinical example, we'll be focusing on the mesial buccal canal. All of the other canals are simultaneously prepared with the same techniques. We've just edited out most of those steps. Explore the space with small lexicon hand files. The GT Rotary technique begins with the 20 series. The 2010 is inserted and allowed to work. Notice how you never hold the file in one position. Work it in the canal space. Remove files frequently to clean and inspect the flutes. Irrigate and lubricate between each instrument. The GT 2008 is next. Again, it is worked passively only as far as the file wants to progress. We've included this irrigation sequence to remind you to irrigate and lubricate before moving to the next instrument. The 2006 is next. In this particular canal, this instrument is allowed to do a good amount of work, and the result is this file reaches the estimated working length. Again, irrigate with sodium hypochlorite to break down the organic matter. The 2006 reached length in all of the canals. If it had not, we would have moved to the 2004. With the GT technique, this is decision time. The clinician must decide if the rotary instrument that reached working length is going to dictate the final apical size or if the preparation is going to be enlarged. The gauging process begins when a size 20 hand file is introduced. A passive fit at the apex is what is being felt for. The blue size 30K file is inserted. In this canal, it reaches length, but the fit is fairly snug. A black-handled 40 hand file does not reach length. Therefore, a clinical decision to use the 30 series is made for this canal. Because the 2006 reached length, we move to the corresponding taper in the 30 series. The 30.06 is inserted. In 3 strokes, this instrument is almost to working length, but not quite. In this canal, we'll continue with the 30.04. It gets to length pretty easily. Because of the safe-ended nature of the GTs, you can take the instrument to the apex a few times. If more taper were desired, the 30.06 could easily be reinserted at this point, but we're comfortable with the prep as it is. A 30 hand file is brought back in to quickly show that there is a nice passive fit. Another irrigation with sodium hypochlorite is suggested. Because with the GT instruments, your obturator is matched to the last file used, this canal is ready for a final rinse with BioPure MTAD. The canal should only be dried with paper points after the use of BioPure MTAD. The canals are ready for obturation.